Good afternoon. I will be dictating a history and physical on a 61-year-old female admitted to the surgical service with colovaginal fistula. The patient's chief complaint is colovaginal fistula. The patient presented to the gynecologist's office due to increasing brown vaginal discharge for pelvic exam and pap smear yesterday. The gynecologist was suspicious for lesion or fistula after pelvic exam. They ordered an abdominal and pelvic CT with PO and IV contrast. The colovaginal fistula was readily visible on CT scan. General surgery was consulted and the patient was placed on the schedule for colovaginal fistula repair tomorrow morning. Patient's past medical history includes hypertension. She has had a total hysterectomy. Her home medications include lisinopril 20 milligrams daily. She is allergic to sulfa. The patient's social history is that she lives at home alone. She does not smoke or drink alcohol. She takes good care of herself and is a retired postal worker. Her family history: her parents are living, mother has hypertension, and father is healthy. The patient is up to date on her yearly flu vaccine and has had her pneumonia vaccine within the last 5 years. Upon review of systems, the patient denies any blurred vision, glaucoma, visual changes. She denies any ringing in the ears or hearing loss. She denies any difficulty swallowing or sinus problems. She denies any soreness in her throat, any history of TMJ or any difficulty swallowing. She denies any confusion, dizziness, memory loss, or changes in mood or behavior. She denies any shortness of breath, dyspnea, or cough. She denies any chest pain or heaviness, denies any blackouts, palpitations, any peripheral edema, DVT, or irregular heartbeat. She does report her history of high blood pressure to me. She denies any sort of abdominal pain, nausea, or vomiting. She denies any diarrhea or constipation. She denies GERD and does not have a history of hepatitis or GI bleeds. Genitourinary: the patient denies any pain with urination or any blood in the urine. She is not experiencing frequency or urgency. She does report the vaginal discharge, which is brown in color and increasing over the last week. The patient denies any sort of arthritis, rheumatoid arthritis, osteoarthritis, swollen joints, or neck pain. She does not have any sort of history of skin disease, eczema, or dermatitis. Upon physical exam, her vital signs are as follow: blood pressure 142/78, pulse 76, respiratory rate of 18, and 99% on room air. The patient has been afebrile since admission. The patient is a Caucasian female. She is slightly overweight, sitting in her hospital bed. She is conversing freely with appropriate conversation, appears to be well developed, and asks appropriate questions. Her head appears to be normal with no noted malformations or trauma. Her facial expressions are symmetrical bilaterally. Her eyes are prola 3 millimeters bilaterally. There are no redness or drainage and no exophthalmos noted. The patient has no signs and symptoms of hearing difficulty. Her ears appear normal and symmetrical bilaterally. No deformity noted. Her inner ear canals are without drainage or redness. Her tympanic membranes are pearly gray with landmark and cone of light visualized bilaterally. There is no nasal redness or drainage noted. Her neck is supple without swelling. Nodes are within normal limits during palpation. Her throat is clear of redness and no exudate noted. The patient does not have any JVD noted upon physical exam. The patient is 99% on room air. She has no dyspnea, respirations are even unlabored, and her rate is regular. Her lung sounds are clear bilaterally. Cardiac status: her blood pressure is stable at 142/78. Her pulse is 76 with regular rate and rhythm. S1 and S2 are present without gallops, murmurs, or rubs, and her cap refill is less than 2 seconds in bilateral extremities. GI and GU: her abdomen is soft, non-tender, and flat. Her bowel sounds are present, normal active times all 4 quadrants. She has no masses felt with palpation, no rebound tenderness or guarding. She denies any pain or bleeding with urination. She does report discomfort with rectal exam, but no bleeding noted. The patient has no kyphosis or scoliosis noted. All cranial nerves are intact. Sensation to light touch is intact bilaterally. Her deep tendon reflexes are intact bilaterally. Her grips are strong and equal. She's currently awake and alert, oriented to person, place, and time. Radiology studies: the patient had an outpatient CT of the abdomen and pelvis with PO and IV contrast, which showed colovaginal fistula. Preoperative lab has been ordered by the surgical services, CBC with differential, CMP, EKG, UA with reflex culture, and a chest x-ray has been ordered. Diagnosis is number 1, colovaginal fistula. Plan is as follows. Number 1, the patient is being admitted to the services of general surgery group to medical surgical floor. She's to be placed on clear liquids until midnight and then made MPO at midnight. The patient is to be given a dose of mag citrate bottle now and then another in 8 hours. Nursing is to notify the physician if the patient is not having clear stools by the morning. IV fluids are saline at 100 cc's per hour. Tylenol 650 milligrams every 4 hours is needed for pain. Nursing is to keep her O2 sats greater than 92%. She is to start on Protonix 40 milligrams IV daily, and the patient is a full code. Thank you.